Hello everyone, welcome back to my channel Little Things with Little One, and today we are going to talk about breastfeeding. Breastfeeding, I think, is the most important part in your motherhood journey. It is not very easy for most of the moms. I have faced many challenges in breastfeeding sessions, so I have compiled a list of 10 questions or I would say things that you might encounter during breastfeeding sessions. I hope it will help you to fix the breastfeeding relationship with your baby. So let's get started. The first thing or the first problem is my baby won't latch. So this is a common problem and happens with lots of moms. I think some kids are pro and they know how to latch from day one itself, but for some moms it is very challenging and they have to go through a lot of practice before they are able to properly breastfeed your baby. So some of the things that you can try is give lot of skin to skin to your baby. This will also stimulate breast milk supply. The second thing is get your baby near to your breast and hold your nipple in scissor like position. This helped me a lot. And the third thing is try different positions like shown in the picture. The second thing or the latching could not be properly done because maybe possible that your nipples are flat or inverted. So I had the flat nipples and that is why it took me around a week to actually properly breastfeed Shrigun. So what you can do is use a nipple shield. So there are many brands nipple shields are available. You can try them, and then you can use a breast pump. So just before feeding for 3-4 minutes just use a breast pump and then try to latch your baby. And the third thing that worked for me is use a syringing method like shown in the picture. So this will also help in better latching your. The third thing or the third problem could be for some moms latching may be hurting. So whenever you're trying to breastfeed your baby, you may experience some pain. So some tenderness or some sensitivity is normal and happens, I think, with most of the women. But if the pain is too much, or if you see the breast are pink, or you're always in pain even after feeding, then you should actually consult a doctor. But sometimes it is maybe only because of the wrong latching. So try some different positions, or always take your baby near to your breast and cover more of the areola below the nipple. This is the best latching position. The fourth problem for some moms could be that baby is making gulping sound, choking, or fussy at the breast. This could be symptoms of oversupply of breast milk. This happens with me also, and what I did is block feeding. So choose a block or a period of 2 to 4 hours, and in between that time, whenever you are breastfeeding your baby, always offer one breast, and only after that block or only after 2 to 4 hours offer another breast. So what happens is your body receives the signal that okay, your breast is fuller and no need to produce extra milk. So this will reduce your breast milk supply. But try this only if you think that you have oversupply of milk. The other thing you can do is hand express some milk before feeding. This will ease out the milk flow, and your baby will not be so fuzzy or will be better able to breastfeed. The fifth thing is breast engorgement or swelling. So this happens in the initial days when your baby is still learning on how to breastfeed, and what you can do is hand express some milk. This will ease out the flow of milk and get you some relief with the engorgement. The other thing is use a warm compress or take a hot water shower. This will also help, and wear a comfortable bra. The next thing, after engorgement you can feel your breast seems less fuller. So once the milk supply has been established and your baby is producing enough milk as per the requirement of your baby, it is possible that you do not always feel engorgement. So this is very normal, and this is very happens, I think, with most of the women, and it does not mean that you have less supply of milk. Only thing is you have to check the baby's diaper. So if baby's pee count is more than 6 and they are gaining proper weight, that means you do not have the less supply of milk. The next one is how to increase the breast milk supply. So this is the most common questions or most common thing you might be thinking when you are breastfeeding your baby. Though there are some foods that you can try out to boost up your milk supply, there are some other things that will also help you, like feed very frequently. So it is like so breast milk depends on the demand and supply mechanism. So if you will feed more to your child, your body will produce more milk. You can also try pumping between the feedings and store that milk and feed your child afterwards. The foods that actually boost up the milk supply are all these. The eighth thing is how much and when to feed. So as per the doctors, up to 3 months you should feed your baby in every 2 hours, but to be honest, that is not always possible because you also need some rest. So what I used to do is, in the day I was always trying to feed the Shrigun in between 2-3 hours, but if in the night she's sleeping, I will only wake her up after 4 hours. So I was not going beyond 4 hours because their stomach is very tiny, and that is why I was always feeding at least in between 4 hours. But after 3 months you can feed on demand and look for the hunger cues, and what you can do to check if your baby is being fed properly or not. So if your baby is active, alert, controlled, and playful, and having pee more than 6 times, gaining proper weight, that means your baby is being fed properly. The next thing is baby is always sleeping during breastfeeding. So yes, in the initial months, at least up to 3 months, whenever you are trying to feed your baby, they may sleep within 5 to 10 minutes, and it is very common. But if you think you have not fed enough to your baby and you want to feed more, what you can do is take them in upright position, try to burp them, play with them, or tickle their chin or finger. This will make them active for some more time, and they may be latch on to the breast for some more time. And the last thing is baby is always feeding. Yes, it is. In the initial months you will be spending a lot of time in feeding your baby. Sometimes feeding goes for more than 1 hour. Their stomach is very small, and on an average baby double their birth weight at the age of 6. So they feel hunger very frequently, and sometimes they constantly want to feed because of the comfort, and because they feel more safe when you are near to them. But if your feeding session goes for a long time, that doesn't mean that you are producing less milk. I have seen that sometimes if baby is still crying after feeding, people start with the formula milk and think that they are not producing enough milk, but that is not the case. Try to play with them, engage them in some activity, use a rocker or a swing to make them sleep. But cranky child, or if the baby is crying, doesn't mean that you are producing less milk. If baby is constantly wanting to feed, it may not be due to always hunger. Like I said, it can be due to comfort as well. So you should not give up on breastfeeding so easily and switch on to formula very easily. You should actually consult a lactation expert if you think that you have a less breast milk supply, or baby is always hungry, or baby is always crying. They will help you to help in boosting up your breast milk, and again having a good relation with your kid, having a good breastfeeding relation with your kid. So that is all in the today's video. If you like my video, please subscribe to my channel, like and share. See you in the next video. Bye bye.